condoms. We had it a lot during those days. And there's a time I also had an advert that had these two statements. Most people get HIV and STDs from the ones they love. And also most people pass STDs to the ones they love most. So then I wanted to start with these statements so that we know that we are addressing people who love one another. As we're talking about sexual health and what to do about suspicion of STD, STI. Okay, so I will start by telling you what is normal, and then we will go to broadly what is abnormal. So in the absence of an infection, so this is normalcy in the female. The normal vaginal
Caroline, Belinda, please mute yourself and allow me to just Okay, Dr. Ari, please unmute. Sorry.
You can hear me. So sorry about that. Certain changes are normal also, but around the time of ovulation, you have a thicker and a heavier discharge that then thins out and gets a bit stretchy. It increases in amount during sexual excitement and during pregnancy, and reduces in amount when one is using progesterone medication, including progesterone contraceptives, also during menopause. So this picture is just to try and show you that vaginal discharge is clear, which is normal, which is here. It might be whitish, which might also be normal, but if it has chunky components, so what we call card-like discharge, then it might be due to a yeast infection. A great discharge could be bacterial vaginosis, a type of alteration of normal flora inside the vagina. A yellowish discharge could mean there's an infection. A greenish discharge could mean there's an infection. A pinkish discharge may mean a bit of blood stain, could mean pregnancy, could mean injury to the cervix or vagina, or a fluid right at the beginning of menses, so blood stain. A reddish discharge means blood, so it could be an infection, it could be abnormal bleeding, it could be bleeding during pregnancy. A brownish discharge may be towards the end of a period or when we have what we call a missed miscarriage, and it might be watery or liquid during sexual excitement, and that is normal. The males expect that they're dry, they don't have a discharge, they shouldn't have pain during urination, and also they shouldn't have pain during intercourse, amongst other symptoms that I'm going to list when I'm telling you a bit about symptoms of STD, STI. So in this discussion, I'm going to try and put some highlight on, making the general public understand what is STD, STI. What are some of the common examples of STDs and STIs, and what are some of the symptoms that may be due to STDs, STIs? When should one be worried and need to see a doctor? Is there such a thing as emerging STDs, STIs? There is a discussion difficulty. Okay, how do we go about talking about STDs, STI, especially in relationships? What are some of these common myths and misunderstandings regarding STDs and STI? And a little bit about the role of healthcare providers for our end. What are we supposed to do for our clients and patients? So by the end of this, we need to have some benefits and be able to talk freely and easily about the possibility that STDs, STIs are part of us. So initiate individual and partner drive to consult regarding sexual health. So come to us. Don't be afraid to consult about sexual health. You're better off being told that all is well than thinking all is well and there's a bit that is not well. So visit a healthcare institution for consultation about your sexual health. Chukua control. Okay. So we will talk, test, treat, among others. This was a promotion campaign in, I think, Canada. That's where I got this slide from. So what is an STD or an STI? An STI means sexually transmitted infection. This is when somebody acquires a virus, a bacteria, a parasite sexually. All right. We call it STD when now that parasite, that bacteria, that virus, the interaction of that microorganism together with the host immune response results in certain symptoms and signs. And that becomes the disease process. So disease happens when one develops symptoms and signs of infection. So most of the time when we're talking about STDs and STI, we are talking about the same thing. And it's acceptable for the terminology to be used interchangeably, that these are infections or diseases that result due to sexual contact. So even in these slides, where you see I've probably just put STD or I've put STI, it means the same thing. Okay, how else do we refer to as STI? I just got a few nicknames that it has been given, but also people have given it more than this. Venereal disease, even in medical fields, people still use that terminology. Cupid's itch, venuses, CAS, virus or kirusi, social distance, and social disease rather, and kuchomeka or kuban. So people may come and tell us, symptoms, and if a patient probably comes to us, they may just come and tell us, daktari nimechomeka. They probably know what has happened, okay, or they're telling colleagues and friends that kuchomeka has happened. So don't be afraid to talk about these symptoms. So acquisition of these microorganisms. This was from an LGBTQA platform, but it is part of sexual health, and we see different patients as we talk about these things. So acquisition of sexually transmitted disease through sexual contact. Okay, and sexual contact varies from touch, caressing, kissing, touching, rubbing of genitals, sexual intercourse. That may be oral, mouth, penis, mouth to vagina, mouth to mouth, and even the anus is involved. It might be penetrative intercourse, penis to vagina, all right, to the anus or to the mouth, and so on and so forth. And here, this slide also tells us how risk of transmission increases depending on the mode of contact. And then now there are certain misconceptions regarding transmission. I had to choose to put this slide here because we get many patients, and this is a common error even some of us make, of confusing sexually transmitted infections as acquired through using toilets, and also imagining that vaginal breaching prevents transmission. Okay, and some males imagine taking a shower after sexual contact reduces likelihood of transmission. So these are misconceptions. It is not transmissible from the toilet seat. It is not transmission. It's not prevented by showering or douching. So this is going to be a bit about lists of examples of STDs and STIs, and I tried to group them depending on the symptom, the major symptom they cause, and how we classify them medically. That we have diseases that cause ulceration. Examples are syphilis or chancroid, herpes virus, and granuloma inguinale. And then we have diseases that cause an abnormal discharge, like gonorrhea. gonorrhea, chlamydia, and trichomoniasis. Okay, we have infections that cause swellings, like lymphogranuloma venereum. So you might see others appearing more than once, like chancroid and human papillomavirus. And we have infections that cause disease elsewhere, not necessarily in the genitals, like HIV, hepatitis B, C, and D, and others are parasites that occupy the pubic area and cause irritation, like pubic lice and scabies. So generally speaking, and in our setting, I can tell you some of the commonest symptoms we encounter is ulceration and abnormal vaginal discharge, and now disease elsewhere other than disease in the genitals. It's been long since I saw a patient with scabies and pubic lice affecting the pubic area, but they exist. I've seen them in the past. So this is to tell you that there have been many bacteria, viruses, parasites that have been listed to cause sexually transmitted diseases. 8 of these are linked to the greatest incidence of STDs. 4 out of these 8 are considered curable as long as we make diagnosis early before they cause severe morbidity and treat them. So they should be curable, like syphilis, gonorrhea, chlamydia, and trichomoniasis. And there are others, viral infections that once acquired, somebody needs to learn how to live with them and what they need to do from time to time to prevent progression of disease and prevent further transmission, including transmission to an unborn baby. Okay, so those are important for us to know. So what are some of the symptoms and signs of STDs, STI? I put this picture just to show you that the list of symptoms I'm going to put down is going to probably reduce one's confidence that they have never acquired an STD or STI. Just like we know, communicable diseases are very easily communicable. These diseases are passed easily from one person to another, and human beings are social beings, and we interact, and sexual interaction is also part of our lives, so we know that happens. So everything we believe about self-confidence is a lie. Majority of infections are asymptomatic. Many patients don't have symptoms or signs of disease, and therefore they may not even know that they are affected. The lack of symptoms varies depending on the type of microorganism that is causing the disease, and this happens in both men and women alike. So the confidence that this affects women or this affects men should just be laid to rest. And now approach sexual health differently, knowing that there is a possibility that there is a bug around as long as we are sexually active. Common symptoms and signs of an STI, I decided to group them as what might manifest in a male and what might manifest in a female. Okay, so males may present with urethral discharge, ulceration of the genitals, and I'll show you maybe 1 or 2 pictures of a genital ulcer. Painful urination, this is what they usually say, chomeka, swellings, scrotal and testicular pain or swelling, painful intercourse, painful ejaculation, painful defecation. So they might not have any symptoms on the genitals, but when they go for pass two, they express pain. They may have both ulcers and oral ulcers, a sore throat, painful swallowing, and low abdominal pain can also be a concern. Can I tell whether is muted to mute? Am I muted? Can I?
Yes, yes, look, you can continue.
All right. So common symptoms and signs now in the female population is an abnormal vaginal discharge, genital ulceration, painful urination. Though this one should not be confused with itchiness. All right. Painful urination is different from itchiness. Swellings, bleeding, painful intercourse, defecation, mouth ulcers, sore throat, painful swallowing, low abdominal pain, and itchiness can also be part of the symptoms in the spectrum that a female may present with. So from here, the next few slides are going to have samples of pictures. Some of these pictures are the disclaimer that I actually told you may be cross. So therefore, if you're with children, you might want to take gadgets away from them so that you don't show them images that may be of adult content. Okay. So what is the most common symptom of STDs, STIs? I've told you zero, none. Patients will or people are likely to move around with a sexually transmitted bug without any symptoms. The symptoms they probably have are these three that are listed here: love, trust, and freedom. And because they have love, trust, and freedom, they're people we mingle with, they're people we interact with, they're people we have sexual contact with, sexual freedom with, sexual trust with, and therefore a microorganism can be part of us without any symptoms. And therefore, the likelihood that we come to look for medical attention becomes remote because we are not sick. Okay?
Doc,
Yes.
sorry for the interruption. Kindly allow me to, some concern, they're asking you to at least be a bit loud. So that they can-
Okay.
Yes, yes.
Yeah, sorry about that. Thank you for whoever raised that concern. I'll repeat what I've talked about here. That the most common symptom of disease is freedom, trust, love, asymptomatic. Patients don't have symptoms, and therefore they enjoy their sexual freedom and trust and express love sexually. And because they don't have symptoms, they're unlikely to come for consultation and also more likely to transmit in case they have a different sexual relationship or something like that. But then now, the next few images are going to show us, without being specific to a disease, random features that may suggest that one has a sexually transmitted infection. So there's an ulcer here on this gland, right? So this is the penis, and there is an ulcer there. If this ulcer was in a female, it's an ulcer that is painless, and therefore the patient may not even notice they had an ulcer if it is inside the vagina. In the penis, it might be easy to identify. There's an ulcer on the tongue there, and a bit of it here on the lips. This hand has an ulcer there. I'll move my cursor a bit so that you can see it. And this other hand has an ulcer there. This tongue has multiple ulcers. And on this penis, it was not very clear, but there is an ulcer around here where I'm trying to circle. So this is to show you that an ulcer is not necessarily a big hole that looks ugly and something like that. So it might just be a superficial, painless, hard, rubbery ulcer to suggest that there is a disease process. This is an image of warts. So there are tiny warts here. The camera probably has made it look bigger, but these are not very big warts. They're there. They might grow much bigger than this and impair a lot and reduce quality of life, including sexual quality of life. There's a wart here in the tongue, or rather below the tongue, in the mouth. There's a wart here on the penis, and these warts are also probably sexually transmitted. This is an image to show you urethral discharge. So there is a urethral discharge from the penis here. It is whitish. This is definitely a feature of urethral inflammation, most likely due to a sexually transmitted disease and other abnormal discharges. This is the cervix, but here this cervix is inflamed and there is a whitish discharge. Also, you can see inflammation and whitish discharge here. This microorganism also affects the eye, so patients may have what we call a trick, all right, and they may cause throat infection. All this is probably sexually transmitted. Okay, so a discharge, pain during urination, swelling are common in males. A discharge, burning sensation, and pain during urination, and abnormal bleeding between periods can also be signs of infection. So just to remind you that most infections are asymptomatic. So, and they look like us here. You see, we're standing, we are looking okay, we are fine, we are healthy, we are not having any pain, no discharge. So no concern, and we appear as though we don't have any sexually transmitted disease. So you cannot know. So asymptomatic infections are still transmissible. So this can be passed from person to person, and they may continue with the disease process. So some of these infections have a primary stage, secondary stage, tertiary stage. By the time they reach a tertiary stage, they have caused certain severe morbidity that now cannot be reversed. So disease process continues despite one being asymptomatic. So we need to be cautious and probably see a doctor. So when should one be worried and come for a consultation? If one experiences any of the symptoms we've listed, you need to come for a consultation. But then I kept saying and insisting, majority of patients or people having infection will be asymptomatic. So before starting a new sexual relationship, it would be nice to come for screening. Come to a facility, consult with a doctor. There's some tests that can be done. There's examination that can be done, and ruling out certain diseases early enough before initiation of sexual relations. Following a random sexual encounter, one needs to be seen, screening and for diagnosis if necessary. Screening means we don't know if disease is there. We're just going to take some samples to test, to rule out, the way, for example, we do HIV test. Okay, and then when you're planning for pregnancy, it would be nice for us to rule out a sexually transmitted infection. And if you have already conceived, then come for antenatal care, because part of the profiles we do as we see you during antenatal care include screening for sexually transmitted diseases. And then also we have well man and well woman clinics that we run in our facilities. And when you come for these clinics, part of screening may include sexually transmitted infection screening. So let us make it a habit to consult and be screened for certain diseases or infections. There's some diseases that are frequently misdiagnosed as STIs. This is a common error. It's a common error made over the counter, especially when people go over the counter and tell the pharmacist, I'm feeling 1, 2, 3, 4. They may get what we call shooting by machine gun, giving you all antibiotics to cover for everything. So many times urinary tract infections have been confused for sexually transmitted infections. The urinary tract means the system that generates, collects, and passes urine out. That is very different from the genital tract, especially in the females. The organs that pass urine and the sexual organs in the female are different. But in a male, there is one organ that is sexual, and that organ also has the pipe that passes urine out. So an infection in the urethra might easily go to the bladder, and we can easily confuse urinary tract infection in a male for sexually transmitted disease. That has also been the case in females. They're confused a lot for sexually transmitted disease. And then candidiasis. This is a fungal infection. It causes itchiness, a whitish discharge, and cud-like discharge. So it's a bit milky. Candidiasis is not sexually transmitted as much as it affects the genital system. So it may affect the vulva, vagina. Okay, but it's not sexually transmitted. It has been confused so many times for sexually transmitted diseases. Also, sexually transmitted diseases have been confused for candidiasis. So this is a common error. Somebody may be treated as though we are treating candidiasis all the time, yet they actually have a sexually transmitted disease. So it can be confused both ways, that we can think it is candidiasis, yet it is an STI, like trichomoniasis, or it can be confused for trichomoniasis, yet it is candidiasis. Okay, and then this alteration of vaginal flora, what in quote I'll put a change from good bacteria to bad bacteria. The vagina always has good bacteria to protect the vagina from bad bacteria. But then when we have an alteration in the bacterial composition inside the vagina, it's a condition we refer to as bacteriovaginosis. So it will cause an abnormal discharge and other discomforts, but it is not a sexually transmitted infection. So BV, bacteriovaginosis, has been confused for STIs, and vice versa. STIs have been confused for bacterial vaginosis. This is the reason I put this slide here is because of the result. And what is the result of miscommunication? For example, if I tell my patient that you have a urinary tract infection correctly, so I do a test and I find they have a urinary tract infection, but I make an error of not educating them that urinary tract infection is not sexually transmitted. So when I mention you have a UTI, they go back home and they start a fight. I've been diagnosed with a UTI, so where did it come from? UTI is not sexually transmitted. Right? So that's the reason why I put this slide, so that we know that errors can be made. Yes.
Sorry again for interrupting you. Is there a way we can increase your audio, because we still have a few of us who cannot hear you clearly? You sound to be a bit far.
Oh, I'll try to be louder. I don't know if there's well, it's a microphone.
Yeah.
I don't know if
You
there's
can
a way.
try. I know you're
louder.
not used to this, but maybe you can try a little bit. Can be a bit louder.
Okay. My apologies.
Okay,
so,
thank you.
Yes, so I'll just repeat again. UTI, candidiasis, bacterial vaginosis, these are common conditions that affect the urinary and the genital system, but these are not sexually transmitted. We confuse them for sexually transmitted infections frequently, and we also confuse sexually transmitted infections for these non-sexually transmitted infections or alteration of flora. So it is important for us to communicate properly and understand. So in short, let us talk. Let us talk freely about about sexual health. Let us talk about an abnormality that has been picked. Let us consult and let us not be afraid to have treatment sought. So as I was listing the concerns there, I put this question as: is there such a thing as emerging STIs? Okay, you had in the introduction, Dr. talk about superbug. It has been in the news, it has been in the media. And so, what is a superbug? As the pictorial shows there, microorganisms also are creatures. They tend to try and survive. So they look for a way to navigate the immunity. They develop, ways to fight or to survive presence of antibiotics and so on and so forth. So these new strains that develop, the offspring strains of microorganisms, develop resistance to antibiotics. And therefore, if they're exposed to such antibiotics later in their lives, or if they're in a new host or the same host and they're exposed to the same antibiotic that they have already developed resistance to, they will survive it. In fact, they will not be cured, they will not be killed to completion. So this is important information for us to synthesize, because antibiotic resistance comes by use of antibiotics without indication. So we may be given antibiotics, or we may use antibiotics and not use them properly, or use antibiotics when it's not necessary, and we keep exposing these microorganisms to various antibiotics that may not be necessary at that time. So over time, they get friendly with antibiotics and they know how to live with each other. So supergonorrhea is an example of a superbug. So we just call it a gonorrhea superbug. So it's called supergonorrhea. That is to tell you it is a gonorrhea species that now have developed resistance against most recommended antibiotics that are used to treat against gonorrhea. Gonorrhea is not the only superbug in circulation. So that I put a hot spanner to the works. It is good that you know that it is not only supergonorrhea that we have. We have many other superbugs around, including sexually transmitted superbugs. So even syphilis, they are developing resistance. So we have evidence, increasing evidence to show that most microorganisms are learning to live with antibiotics in the same environment, so making them superbugs. A little about treatment. This one I made it very, maybe just one slide, because I would leave this to medical students and doctors and clinicians. When we treat, we either approach it syndromically to show that this patient has come with certain syndromes. Syndromes here means symptoms and signs, or we get specific to the bugs that are causing disease. So depending on our ability to make diagnosis, screen, therefore it will inform treatment. So I don't dwell on treatment. We'll go to prevention. You'll be told the most effective way to prevent against sexually transmitted infections is to not have sex. So without sexual contact, then we cannot transmit sexually transmitted infections or microorganisms. So sexual contact, if you delete sexual contact, no transmission. But in leaving to the fact that sexual contact is part of life, and therefore people have to talk about sexual quality of life, we have to talk about safe sex practices. This is the way to prevent most of the sexually transmitted microorganisms. So again, right, are they mute? All right, thank you. Sorry about that. So again, to be able to talk about sex helps with prevention of transmission. So let's feel free to talk about sexually transmitted infections and sex. It improves sexual habits. It improves sexual health. We pick and detect disease early and treat it, and therefore prevent further transmission, including transmission from mother to a child. So fungua roho naongea. So amongst people in relationships and also with your healthcare provider. So visit the hospital. So some of the tips we might want to share with you is use barriers such as condoms and dental dams and finger coats for various sexual practices. I have not seen some of these things, like finger coats. I have not seen them, so I don't know if they are available in our market. But yes, this information is out there. Use recommended lubricants. So not all lubricants are safe with condoms. So there are some that may cause condom breakage. Wash sex toys and decontaminate them. Keep communication open. I've stressed this enough times. And then faithfulness. All right. Try and limit sexual partners. So if we cannot abstain, let it be one. So limit sexual partners, and also screening for both of you in relationships, so that we pick up bugs early and we treat them. So our role as gynecologists and as healthcare workers is to take care of that system. So trim out inflammation and disease by early detection of disease and prevention of progression of disease and prevention of further transmission of disease, ensuring you have a healthy reproductive system, and therefore you enjoy your sexual life, because sex has these benefits, emotional benefits and physical benefits. I think this is the last slide I have. I would like to thank you very much. I tried as much as possible to be as broad and as as superficial as much as possible, so that this is a general topic for discussion. Again, my name is Dr. Micheka, obstetrician and gynecologist, lecturer School of Medicine JQuat, and a consultant for AR Healthcare and Coptic Mission Hospital. Karibuni sana. So questions.
Thank you, Dr. for your presentation. It was detailed yet simple and right to the point. Sorry, I know majority of us were complaining about not being audible enough, but I am hoping that we've been able to pick something, one or two things. So before I do summarize also what Dr. has talked about, and at least let you know what we also have in AR healthcare, I would like to welcome any questions. I will start with a few people who had their hands raised earlier on. Is Peter Owino. I don't know whether you have a question or you had a concern. Okay, as we wait for Peter, I can also see Bonnie. Bonnie, you also had your hand raised. I don't know whether it was a concern or a question. And Rebecca Phillips, but Rebecca has put down her concern and now she can be able to hear you. So we do have Felix Gadua who asks if it's possible for Dr. Rich to share the slides. We shall work on that and then we shall ensure that we are able to share the slides once we have finalized everything. There is one question, can one ovulate immediately after periods?
Should I respond to that immediately?
Yes, Dr.
All right, yes, Penina, yes, the answer is yes, one can ovulate immediately after periods. Ovulation occurs 14 days before onset of the next menstrual flow. So the normal menstrual cycle ranges between 21 days to 35 days according to old literature. Nowadays, we accept saying that the normal menstrual cycle should last less than 38 days, slightly above. So from 24 to 38 days is normal. So an individual may have a long cycle, say 35 days, or another one may have a short cycle of say 21 days. Ovulation occurs 14 days prior to onset of a new cycle. So if someone has a cycle of 21 days, for example, they will ovulate on day 7, which is soon after menses. So yes, the answer to that is ovulation can occur following menses. That's to Penina.
Okay, thank you, Dr. Ray. Penina, I hope that was clear and audible enough. As we wait for more questions, I would like to emphasize just a few things. I hope we got to also notice that Dr. Ray said that we have around 30 infections that people can present with discharges, and around 30 of them would be bacterial or viral. And out of that, you might find that 4, we have 8, which would be most probably sexually transmitted infections. And out of the 4, we have those that we can treat, and 4, we have those that we may not be able to treat. So the 4 curable would be syphilis, would be gonorrhea, chlamydia, and trichomonas. And then we have viral infections, mostly can become something that you have to live with it as a thorn in your flesh. But however, we can be able to manage the symptoms. So as we all say, mapema your best. So we do have some sexually transmitted diseases packages, ranging from 5,000 to 15,000, whatever you want, yeah? We also did hear Dr. Ray mention about human papilloma virus, and we have heard a lot about it, and I'm sure most of us have heard that it's the causative factor of cancer of the cervix, and we can be able to vaccinate. So nowadays, the government, we are giving vaccines in all our facilities, including the free vaccines for children who are below 14 years. So if you have a daughter, please ensure that you visit and let them get vaccinated, because we can be able to ensure that they are safe even for future, to avoid at least, the cancer of the cervix in future. So I can see already there's another question for female partners who have candidiasis. Should the male partner be treated, and what dosage of antifungal? Dr. this is for you.
All right. We said it's one of those infections that are commonly confused for sexually transmitted diseases. And candidiasis can, due to one reason or another, occasionally be recurrent and probably cause disharmony in relationship. So we define it as recurrent when somebody has had 4 or more episodes or flares of candida inflammation in a period of 12 months. So if in 1 year somebody has had candidiasis 4 times and above, then that is referred to as recurrent vaginal candidiasis. And it needs a certain schedule of treatment that may last even up to 6 months of pulsatile treatment. There is no evidence that there is benefit in treating the male partner. So it has not been mentioned as a recommendation, or there is no evidence. Fungi are organisms that are present everywhere, on garments, on hair, in the pubic area, around the vagina. Fungi are there. So even on the penis, there is fungi. And there is no need to kill them because they're not sexually transmitted. So we don't have evidence that treating the male partner improves outcomes while treating the female. Though I will add to that we may have missed a sexually transmitted disease, or we may have mixed infections so that a patient keeps being treated as having candidiasis. Yet we have missed something else, and we are not treating the male partner for something else. That may therefore result in recurrent symptoms. So it will be nice for people to be able to talk about and to visit a facility for proper screening and diagnosis and treatment. Thank you.
Thank you, Dr. I think when you're still on that, it's in. I know most of us sometimes, most women would ask, "I have a UTI," and I know you've highlighted that that is not a sexually transmitted disease or infection, but they insist that their partners should be treated. Should that be the case?
Feel free to talk with us when you come. So UTI is not sexually transmitted, so therefore their partners don't need to be treated. Uh, but now this is skills of communication. We have found more than a number of times a patient may tell you, "I'd like my partner treated," and the intention is because they're not able to tell you, "I think I have an STI." They have probably been diagnosed, so we don't know what's going on. But urinary tract infection is not sexually transmitted. But on that, I will add, sexual activity may promote urinary tract infection. For example, after a wedding, people go on honeymoon, and during honeymoon, the whole time, there's a lot of sexual activity that may happen. After that honeymoon, it is very common that they get what we call honeymoon cystitis. So that is a urinary tract infection. And so because of that history that there was sex and then now they have a UTI, they may think that sexual activity, or rather the UTI, was sexually transmitted. UTI is not sexually transmitted, and therefore there is no evidence that treating a partner is important.
Okay, thank you, Doc, for that. I also do know that I have highlighted about human papilloma virus, and I know that sometimes we tell women you need to be vaccinated, and also it is sexually transmitted, and you have your male partners being vaccinated. So would you highlight on that the mode of transmission of HPV and why we are vaccinating the women?
Okay, thank you. I didn't say so much about HPV. I probably just listed it as one of these bugs that can be sexually transmitted. HPV is propagated by sex. That's what the argument is. It doesn't cause symptoms, usually, most of the time. Presence of HPV in the external genitalia can be moved into the internal genitalia during sexual activity. So using condoms might not really help in prevention of transmission of HPV. Most of the time, one's immunity is good enough to fight presence of HPV, especially in people who have already been sexually exposed and they have already acquired HPV from time to time. Persistence of HPV presence is what now causes disease, and these diseases can lead to cancers. Cancer of the external genitalia, the vulva, or cancer of the cervix. So what do we do then in people who have already had sexual intercourse before? It is important for us to screen for cancer of the cervix. So from time to time, you're advised to have a pap smear done, or a HPV DNA. There's a test for HPV specific, so HPV DNA test done. So that is part of screening for HPV presence and changes that may occur in the cervix. Now, the government is supporting, bodies are supporting, I support vaccination. But what is the best time to vaccinate individuals? It will be before they have their first sexual encounter. So what has the government done? What have international bodies recommended? What have WHO recommended? Vaccination of young boys and girls before sexual debut, before they start having sexual intercourse, they need to have vaccination against HPV. And that prevents against development of cancer of the cervix, or even cancer of the penis, or transmission of it further later in life. So boys and girls between the ages of 9 and 14, or even beyond that, as long as they have not gotten exposure to sexual intercourse, should be vaccinated. So kindly visit the facilities for vaccination. Vaccination uptake is not very good in the country because many mothers think their babies got all the vaccines by the time they were 2 years old. So you don't bring your older children to clinics for vaccination. Yeah, it's not a good habit. We need to continue and follow through with vaccination because vaccination helps prevent against these diseases. Thank you.
Okay, thank you, Dr. I do not want to leave anyone out. So if you have any question, any pressing question, you can just post and I will ask on your behalf. So do we have any more questions before we wind up?
I can see some questions on the chat box. Can I just read them and respond?
Ah, sorry. Yeah,
Mm.
now I can, yes, I can discuss. So sorry. Kindly elaborate and proper hygiene between two sexual partners cause an STI.
um, so sexual hygiene is important. Um, so sexual hygiene is a lot of things. I wish I'd put a little more about sexual hygiene. So sexual hygiene here means what are the practices around sexual contact and sexual intercourse. For example, well, people want to be as spontaneous as possible wherever possible, and so on and so forth. You've seen a few pictures showing, for example, hands that have lesions that are lesions of sexually transmitted infections. So if we don't take care of our hands, we don't wash our hands before sexual contact, if we don't keep the environment of the vagina clean, then sexual hygiene can predispose to certain manifestations that can be sexually transmitted or can be confused to be sexually transmitted, like bacterial vaginosis. So it might be that the microorganisms are sexually transmitted, or they are not sexually transmitted, but poor sexual hygiene has contributed to their presence and their persistence. So it's good manners to have good sexual hygiene. Sexual hygiene does not include douching. The inside of the vagina takes care of itself. If it is not naturally healthy, it should be treated using medication. That space is left for the penis, for a baby to pass through, and for medicine when it is prescribed. So no water, no liquids, no soap. Do not wash inside there. And I've also seen babies who have been burnt because they were doing a ritual of I don't know, cleansing the vagina. So it's not necessary.
Okay, thank you, Doc. So the next question. First of all, thank you for your presentation from Judy. With increasing numbers of adolescents self-presenting with STIs, how do we handle their treatment, and is parental consent for investigations and treatment required?
Um, in this part of the world, that becomes a difficult question to answer, especially because we have not started appreciating certain facts. We have teenagers who are involving in sex, they are sexually active. So we can't promote teenage sex, that's what we're being told. But then we can't close our eyes and sweep it under the carpet that they're not sexually active. They are. And when they are unwell or they are sick, then they are patients and they have all rights to be treated. The caregiver, the person who's coming to pay the bills, may say they have a right to information. They want to know what their children are suffering from and how to go about it. So it is communication that is important here. So how do you go about discussing it with caregivers and so on and so forth? So there's a lot about childhood disease, teenage disease, adolescent disease, and how to go about treatment. But generally speaking, treatment is standard. I didn't go deep into treatment because of the fact that we're talking to general public, but we don't treat a child who has gonorrhea different from an adult who has gonorrhea. Treatment is standard. So the recommended treatment, the recommended investigation, the recommended treatment should be offered, and also recommended post-treatment care should be given. So talk to them also about use of protection as much as it might appear to somebody else like you're promoting sexual intercourse among teenagers, but because you're treating a sexually transmitted disease, we have to talk about prevention of further transmission of disease. Okay, I hope I've answered that question.
Yes, you have. And I also just want to like to add, sometimes we want to bury our head in the sand and just assume things are not happening. But again, the kind of exposure the teenagers have right now is not what we had 10 years ago. So I think this is an issue that will need to be addressed, and I can see where you're coming from. But also, there's also something about contact tracing. whenever you have someone who has an STI, we also have to do contact tracing so that we can be able to arrest it and ensure that no one else gets that. The next question is there any positive effect if a man maturates immediately after sex? Maturating is, for those who commoners, what do you call it? Passing urine immediately after sex. Yes, Daktari.
Well, their comfort, that is what I would respond. I'll say at their comfort, they can do whatever they want after. But with regards to prevention of sexually transmitted diseases, urination, taking a shower, that doesn't make a difference. So those are those myths that people think. I know of a famous story in South Africa of a famous politician who had a shower after sex with a person who was HIV positive. And that was, at the least to say, very careless. So we can't pass that message. Don't tell people that maturation reduces likelihood of transmission. They may carry an infection and think because they don't have symptoms, they don't have disease. That is wrong. Okay.
Thank you, Doc. The other question is, can lubricants cause UTIs? I know you mentioned that water-based is more preferred, but there's a question about, can lubricants cause UTI?
That is an off-label prescription. To me, it's not backed up by science, but well, there are people who do that, but it's not. But it is a recommendation. Okay. So, but the recommendation is to give young boys and girls before sexual debut. Thank you.
Okay, thank you, Doc, for that. It's clear. How frequent should sexual partners have a sexually transmitted disease checkup, an STD check?
Very good question. As frequently as possible. That is the best response I can give, as frequently as possible. But I also tried to list down, concerns. When do you need to see a doctor? For example, when you have a new sexual partner, when you have symptoms, when you've been long without having a checkup, when you know that there is a package somewhere, well woman clinic, well man clinic, and they can do sexual screening, sexual STD screening for you. Visit the hospital and have the screening done. Screening does not mean that STDs will not come again. So you can't say I was screened and I will never be screened again. No. So STDs can still be acquired. We are social beings, we interact, we have sexual intercourse, and therefore microorganisms can easily be passed. Thank you.
Okay, I think you have partly answered the next question, but I will still read it out. Do we have an age limit where Gardasil will be effective for women who have not had sex? And secondly, how effective is vaccination for women who have been screened for cervical cancer and their results are negative?
Just read the second part again. How effective?
How effective is vaccination for women who have been screened for cervical cancer and their results are negative?
Well, the first part, I think I partly
Yes,
answered.
yes, you did.
That it is an off-label prescription. There are people who prescribe, but it's not the recommendation. The second part, I think the author of the question has probably a bit confused in authoring the question. Screening for cervical cancer means these are people who have been sexually active. Okay, so vaccination is not going to uh, tell us not to screen for cervical cancer. Vaccination reduces the likelihood that cervical cancer may occur. Vaccination does not prevent them from meeting with HPV. So HPV might still come, but now they have an immunity against this HPV and they're likely to fight away most of the HPVs that have been targeted by the vaccines. Remember, vaccines don't protect against all strains of HPV. There are so many strains of HPV, but there are a few of them that have been implicated in cancer causation. So HPV, for example, 16 and 18, are the ones that are implicated in cancer causation, and therefore the vaccines will protect against those specific strains. So the additional strains can still cause disease. So it's important for somebody from time to time to have cervical cancer screening done, usually starting from 21 years. They should not go more than 3 years without doing screening. Thank you. I hope I've answered you, Faith.
I hope that you've been answered. The next question, in case where one partner is syphilis positive, does it mean that you have to treat both?
It would be best. It would be best if they are sexually active. So as long as they have had sex and one is tested positive for syphilis, it would be best to treat both. Okay, because syphilis is sexually transmitted, and the disease progression means that there is a point where one may not have symptoms at all. And I also told you that many patients may be asymptomatic, or the lesion of primary syphilis may be missed, so they might not even know that they got some rubbery ulcer somewhere at the bottom of the penis or inside the vagina, and it might be missed, yet syphilis may test positive. So if one has tested positive for syphilis, their partner need to be treated. So that means contact tracing. But now I'll add a little point to that. The tests we do to screen for syphilis have what we call interactions with other, so they can be positive for other diseases. For example, somebody may have a connective tissue disease like lupus that may give you a positive test for syphilis. So if a test for syphilis is positive, one test is not enough to conclude that a person has syphilis. So there are additional investigations we do at the facility before we conclude that this individual has syphilis and needs treatment for syphilis specifically. If we rule out syphilis by the additional tests, then this individual needs other investigations to look for the other possible causes of the false positive syphilis tests. The screening test that came positive may be due to other diseases. Okay, thank you.
Okay, Dr. Ari, so the last question is kindly actually comments. So thank you, Doc, for the presentations and the insights. Well appreciated. Wavinya, it's okay. We are hoping that we answered the first question despite of you missing the previous answer and discussion. And one request from Nikesa is that we should kindly plan for cervical cancer talk. We shall do that. One of the next webinars, we shall discuss that in details and discuss also about vaccination. Just appreciating you again. One comment from Rebecca. We appreciate the insights and great responses to the questions raised. So I would like to end to this meeting, and I appreciate each and every one of us for making time to be in attendance. I am hoping that we have learned something, one or two, and we've also learned that these are things that we can be able to treat. And above everything, I hope you have also learned something about supergonorrhea, because it's all over in the social media and sometimes we easily misinterpret because this has come from an expert. I would also like to appreciate, last but not least, Dr. Thank you, Dr. Cyprian. I would also highlight that he is also based in AR Healthcare, Ruaka. Normally sees patients on Saturdays. Alternative, you can just call. If you feel like you have been left out, we do have a number that we shared on the flyers when you're sharing about the webinar. You can call that number and we can book you in to see a gynecologist. Once again, thank you for making time for this, and thank you for the questions. Thank you, Dr. for that detailed, good presentations and clarity while answering the questions. So I was your moderator, Dr. Lilian Gikandi, outgoing HCM Rongai, incoming Rocker. So thank you so much, everyone. So allow me to end the meeting. I hope I've not left anyone out. Have a good night with the rest of the week.
Okay. Bye-bye.